Premier, thank you for joining me. Is this tough on crime budget more focused on helping you win the next state election than fixing issues that are front and centre of South Australians' minds?
No, far from it. There's a genuine need within South Australian Police because they've seen demand grow, not in crime in the traditional sense and how we might think of it, but more through the burden of increasing demands around domestic violence responses and the really deliberate sort of focus on that, also with call-outs that are attributable to mental health cases. So we've seen that demand grow, and we've also got a growing population, Steph, and we haven't had that big uplift in police numbers in our state now for quite a long period of time. So we're making a deliberate decision to account for the fact that the growth in demand and a growing population means our police resources need to maintain a state of readiness to ensure that South Australia remains one of the safest places in the country.
But yourself and the Treasurer yesterday admitted that overall South Australia's crime rates have dropped, so why try and solve a problem that doesn't exist?
Because police confront unique circumstances that wasn't the case 20 years ago, that transcend the sort of call-outs that we think about in a traditional policing context, and it's impossible to deny. And you know, on Monday night this week, I was out with SAPOL myself, with people on the front line, and you can actually see it on the job sheets coming through, the nature of the call-outs and the level of demand that they have to respond to.
Are you trying to turn crime into an election issue?
No, because I think elections, from my perspective, are always best when they focus on the future and the way that we can invest in our capability as a state into the long term. Sustainable economic growth that delivers for working families. And I'd much rather have elections focused on other matters, you know, education, for instance, rather than crime. But that doesn't mean there isn't a need that we have a responsibility to address.
You mentioned working families. A lot are doing it tough at the moment with cost of living.
Yes.
Why wasn't there more in the budget for families who are doing it tough?
Well, because we've done a lot already, and we have announced new measures on top of all the ones that we've announced.
But those measures were mostly focused on parents. There are a lot of people without school-aged children who are also struggling to pay grocery bills.
That is true. But we've also maintained our support, our unprecedented level of support for people like pensioners, for instance, through the double of the cost of living allowance. So these are big commitments that we've made as a government that do have big budget implications, and we've rolled them out and we're seeking to maintain them. But then, of course, we do have a deliberate focus on looking at families because they've got rising costs. If you've got a household of six and your wages haven't increased at the same rate of inflation over the last 3 years, you've got a particularly large burden in comparison to, say, someone who might be a self-funded retiree, notwithstanding the fact they have challenges too.
The Nurses Union has described this budget as strong on crime but soft on health. Do you agree?
No, I don't, because I think that's, if you look at the budget in isolation of all the other policies that we've introduced since we've come to government, that would be a cheap shot. But if you are actually looking at this holistically in terms of the government's policy, let's take nurses for instance. We committed at the last election that we would employ an extra 300 nurses. Well, we've smashed those numbers out of the park by the tune of many, many hundreds. In fact, I think we might have doubled our recruitment target in respect to nurses, and the number continues to grow. Similarly with doctors, we said we'd employ an extra 100 doctors into our system over the life of our time in government. Last year alone, we increased it by over 300 over and above attrition.
And yet ambulances spent, I think it was more than 3,000 hours on hospital ramps last month.
But they're rolling up to 000 calls on time. And that is the difference between life and death. We made a commitment that we wanted ambulance response times to improve, and they have out of sight in comparison to where we were only a couple of years ago. Having said that, we do have this very big challenge with the federal government in that our hospitals are increasingly clogged up with aged care patients who are ready to be discharged, except they don't have an aged care bed to get into.
You've mentioned the extra nurses and doctors is costing the state hundreds of millions of dollars.
Yeah.
The budget continues to grow each year, but will ramping be fixed in 9 months' time?
Well, we want to see improvement. We have seen evidence of that, not at the pace we'd like though. I mean, that's the truth of it. I think ramping would be demonstrably a lot less now if it weren't the fact that increasingly, every time we open up a bed, we start to see more Commonwealth aged care people coming into hospital, being fixed up, ready to be discharged and not finding a bed to be able to get into in the aged care system. That's a problem that's beyond our control, but it won't deter the fact that we're still investing heavily in health in a way that eclipses our investment in SAPOL, mind you, particularly as those hundreds of beds come online over the next couple of years.
You mentioned the Commonwealth responsibility with the NDIS beds, the aged care beds, but that was still the case at the 2022 state election when you made that promise to fix the rampant
But we
prices.
haven't seen the collapse in the aged care system really at any other point in the country's history, and it is under unprecedented pressure. The Royal Commissions into Aged Care have had the perverse effect of actually having people who provide aged care service delivery less inclined to look after the riskiest patients, particularly dementia patients. So we've now got hospitals full of people that don't need to be there. Quite literally, I think we had over 200 as of this morning.
On hospitals, obviously the new Women's and Children's Hospital, that is one of the reasons why we are seeing rising debt levels in South Australia. Is it responsible for you to be maxing out the state's credit card to the tune of $48 billion?
Well, the big investments that are resulting on the state taking on debt are the completion of the Non-Stop South Road project, which we've been talking about for literally decades in South Australia, and building a brand new Women's and Children's Hospital.
The $48 billion, though, if you break it down within 4 years, I mean, if every South Australian gave you more than around $26,000, you still wouldn't have paid off your debt.
What matters with the debt position is how we're performing relative to our capacity to pay, but also relative to the rest of the country. South Australia has the best credit rating of any state or territory government in the country outside of Western Australia. The best outside of Western Australia. Standard & Poor's gives us the best credit rating versus the others by a substantial margin. So our debt to revenue ratios are strong, and they're what we keep a close eye on. So we've got a growing economy, and we have the capacity to be able to invest in making sure our standard of living remains high.
Premier, thank you for your time.
Thanks, Steph.